The privatization of healthcare in Ontario could soon be a possibility.
What the Ontario Medical Association has suggested is that the government build publicly funded but privately run surgical clinics in order to ease the surgical backlog.
We can't continue doing the same thing. Something has to give. We're going to get the best ideas from the professionals, and we're going to implement those ideas.
We are really we're at a fork in the road, we're at a crossroads in terms of the choices that we're making now that will make the system better or worse in the future. My name is Daniel Raza. I'm a family doctor in Toronto and a board member of Canadian Doctors for Medicare.
I think this conversation around for-profit private delivery of care seems to be discongruent with the actual problems on the ground in our healthcare system.
We know that more corporatization of healthcare, treating health and wellness as commodities to be bought and sold and profit off of, is not actually going to solve the problems we're facing. So I wish we used this time of upheaval in healthcare to focus on solutions that would actually work.
When you look at the highest performing healthcare systems in the world, one of the things that is always present is really high quality primary care. What does that mean? It means that every single person in Ontario, in Canada, should have access to a primary healthcare team, whether it's made up of family doctors or nurse practitioners, but always in a team.
Our entire healthcare system is actually designed to work based on the assumption that everybody has access to a family physician or has access to a primary care provider, and that's absolutely not the case. We know that 5 million Canadians at least don't have access to primary care provider. That's leading to many of the problems when it comes to emergency departments, wait lists, and so on. It's making the suffering worse.
If people don't have a family doctor, where do they go when they get sick? They are going to walk-in clinics. They're not always seeing someone that they know. They're having to explain their story over and over again. It's easier for things to fall through the cracks. So absolutely, if we're interested in building a better healthcare system, one of the places that we must start is primary healthcare.
We've just seen a travesty that has happened in for-profit long-term care facilities where their death rates were much higher compared to not-for-profit long-term care homes with respect to COVID-19 and earlier waves of the pandemic. So actually, what many people might not know is that for-profit long-term care not only provides a worse standard of care, they're more likely to have less staff, but it also costs more for the taxpayer for us to subsidize. So it's more expensive for us. And of course, the profits are coming out of somewhere. We know that in the decade prior to the pandemic, for-profit long-term care corporations in Ontario alone siphoned away $4 billion in money towards shareholders that was paid out. And we can just imagine the impact that would have had if that $4 billion was invested in improving building standards and infection control, improving staffing levels. We would have seen a lot less suffering and death. At this point, we should be ending for-profit long-term care and not expanding this failed model elsewhere.
Right now, believe it or not, when most physicians are making referral, they'll refer to an individual physician, someone they know who might do a good job or someone nearby, but that person might not be the one with the shortest wait list.
A centralized wait list would mean that their patient would then be referred to the person with the shortest wait list rather than someone that they just happen to know. And this itself would help to reduce wait times. We have research that shows that it would reduce wait times very quickly by about 20%.
I think what would be really important right now is to listen to the frontline healthcare providers, to organizations, to policy experts who are all saying, look, everyone agrees our healthcare needs solutions and change. However, bringing in profit into healthcare is not the way to do it. We need to keep the focus on patients and not for profit.